Hi, this is Paris, Mandy. Today I'm doing my presentation on iron deficiency anemia. WC is a 67-year-old male who presents to the pharmacy with a complaint of belly pain. He states that the belly pain started 6 months ago when he began to take 800 milligrams of ibuprofen 4 times a day for osteoarthritis. The abdominal pain has progressed over the last few months. He said the pain would start 1 hour after meals with no relief from antacids or ranitidine. He also disclosed that he had a history of ulcers 5 years ago, so the pharmacist recommended that he discontinue taking the NSAIDs and take Tylenol for the acute pain, not exceeding 2 grams per day. And the pharmacist also scheduled an appointment with his primary care and faxed over some notes. WC has a history of peptic ulcer disease 5 years ago. He smokes about 2 pounds. So he presents to his WC is taking plenty of antacid, which probably made his problem worse. Antacids will reduce the acid in the GI system, which makes it more difficult for food iron to absorb. It is important for WC to know that if he is taking antacids daily too often, that will mean that he needs to see his provider, because taking the antacids are masking a problem that is probably more serious. And in which case he was doing that, he ended up having a significant GI bleed. NSAIDs. So NSAIDs are used for inflammation, pain, and often fever. It is metabolized in the liver and excreted by the kidneys. And major side effect are GI bleeding. He was taking a lot. He was taking the 800 milligrams 4 times a day, which is about 3,200 milligrams per day, and the recommended dose is 2,400 milligrams a day. He also had a history of GI bleed and peptic ulcers, so he really shouldn't have been taking the NSAIDs at all. His doctor should have given him more education about taking these medications in the first place. However, he was in pain due to his arthritis, so he took quite a bit of NSAIDs, which led to his GI bleed. Follow-up wise, they did a patient education. He needs to stop taking the NSAIDs. I think that's very clear, and he understands that now. And those are my references. Thank you for listening to my presentation.